2023 Prometric Practice Nurse Aide Exam Questions and Answers. Number 1. A resident often carries a doll with her, treating it like her baby. One day she is wandering around crying that she can't find her baby. The nurse aide should A. Ask the resident where she last had the doll. B. Ask the activity department if they have any other dolls. C. Offer comfort to the resident and help her look for her baby. D. Let the other staff know the resident is very confused and should be watched closely. The correct answer is C. Offer comfort to the resident and help her look for her baby. Calming the resident is the priority in this scenario. You can try to reorient the resident after finding her baby. Number 2. A nurse aide is asked to change a urinary drainage bag attached to an indwelling urinary catheter. The nurse aide has never done this before. The best response by the nurse aide is to A. Change the indwelling catheter at the same time. B. Ask another nurse aide to change the urinary drainage bag. C. Change the bag asking for help only if the nurse aide has problems. D. Ask a nurse to watch the nurse aide change the bag since it is the first time. The correct answer is D. Ask a nurse to watch the nurse aide change the bag since it is the first time. Never perform a task if you have not been trained to do so. Also, a nurse aide cannot delegate tasks to others. That is a nursing responsibility. Number 3. Before feeding a resident, which of the following is the best reason to wash the resident's hands? A. The resident may still touch his/her mouth or food. B. It reduces the risk of spreading airborne diseases. C. It improves resident morale and appetite. D. The resident needs to keep meal routines. The correct answer is A. The resident may still touch his/her mouth or food. A mask is more effective at reducing the risk of spreading airborne diseases than hand washing alone. Number 4. Which of the following is a job task performed by the nurse aide? A. Participating in resident care planning conferences. B. Taking a telephone order from a physician. C. Giving medications to assigned residents. D. Changing sterile wound dressings. The correct answer is A. Nurse aides may participate in resident care planning conferences. However, they cannot accept orders from physicians, give medications, or perform skills that require sterile technique. Number 5. Which of the following statements is true about range of motion exercises? A. Done just once a day. B. Help prevent strokes and paralysis. C. Require at least 10 reps of each exercise. D. Are often performed during activities of daily living, such as bathing or dressing. The correct answer is D. Range of motion exercises are often performed during activities of daily living, such as bathing or dressing. Patients should be encouraged to move or exercise their extremities more than once per day. Also, a physical therapist would determine how many repetitions are needed. This is usually based on the patient's tolerance level. Number 6. While the nurse aide tries to dress a resident who is confused, the resident keeps trying to grab a hairbrush. The nurse aide should A. Put the hairbrush away and out of sight. B. Give the resident the hairbrush to hold. C. Try to dress the resident more quickly. D. Restrain the resident's hand. The correct answer is B. Give the resident the hairbrush to hold. In this scenario, the resident is confused, not combative. Allowing the resident to hold the hairbrush may serve as a distraction. Number 8. A resident who has cancer is expected to die within the next couple of days. Nursing care for this resident should focus on A. Helping the resident through the stages of grief. B. Providing for the resident's comfort. C. Keeping the resident's care routine, such as for bathing. D. Giving the resident a lot of quiet time and privacy. The correct answer is B. Providing for the resident's comfort is the priority when providing palliative or end-of-life care. Number 9. While giving a bed bath, the nurse aide hears the alarm from a nearby door suddenly go off. The nurse aide should A. Wait a few minutes to see if the alarm stops. B. Report the alarm to the charge nurse immediately. C. Make the resident being bathed safe and go check the door right away. D. Stop the bed bath and go check on the location of all assigned residents. The correct answer is C. Make the resident being bathed safe and go check the door right away. This is the only option that makes the person in your care safe before attending to the alarm. Gloves should be worn for which of the following procedures? A. Emptying a urinary drainage bag. B. Brushing a resident's hair. C. Ambulating a resident. D. Feeding a resident. The correct answer is A. Gloves should be worn when emptying a urinary drainage bag. Number 11. When walking a resident, a gait or transfer belt is often A. Worn around the nurse aide's waist for back support. B. Used to keep the resident positioned properly in the wheelchair. C. Used to help stand the resident, and then removed before walking. D. Put around the resident's waist to provide a way to hold on to the resident. The correct answer is D. Put around the resident's waist to provide a way to hold on to the resident. Number 12. Which of the following statements is true about residents who are restrained? A. They are at greater risk for developing pressure sores. B. They are at lower risk of developing pneumonia. C. Their posture and alignment are improved. D. They are not at risk for falling. The correct answer is A. They are at greater risk for developing pressure sores. A resident has diabetes. Which of the following is a common sign of a low blood sugar? A. Fever. B. Shakiness. C. Thirst. D. Vomiting. The correct answer is B. Shakiness is a common sign of low blood sugar or hypoglycemia. Weakness, lethargy, confusion, and sweating are also symptoms. Number 14. When providing foot care to a resident, it is important for the nurse aide to A. Remove calluses and corns. B. Check the feet for skin breakdown. C. Keep the water cool to prevent burns. D. Apply lotion, including between the toes. The correct answer is B. Check the feet for skin breakdown and notify the nurse of any abnormal findings. Nursing assistants do not clip toenails or remove calluses. Allow the patient to check the water temperature to prevent burns and do not leave lotion or moisture between the toes. Number 15. When feeding a resident, frequent coughing can be a sign the resident is A. Choking. B. Getting full. C. Needs to drink more fluids. D. Having difficulty swallowing. The correct answer is D. If a patient coughs frequently while eating, she may be having difficulty swallowing or aspirating. When a person is choking, there is no air exchange or coughing. Do not give fluids. Instead, perform abdominal thrusts, which is also referred to as the Heimlich maneuver. Number 16. When a person is admitted to the nursing home, the nurse aide should expect that the resident will A. Have problems related to incontinence. B. Require a lot of assistance with personal care. C. Experience a sense of loss related to the life change. D. Adjust more quickly if admitted directly from the hospital. The correct answer is C. A newly admitted resident may experience a sense of loss related to the life change. Number 17. A resident gets dressed and comes out of his room wearing shoes that are from two different pairs. The nurse aide should A. Tease the resident by complimenting the resident's sense of style. B. Ask if the resident realizes that the shoes do not match. C. Remind the resident that the nurse aide can dress the resident. D. Ask if the resident lost some of his shoes. The correct answer is B. Ask if the resident realizes that the shoes do not match. Visual acuity decreases with age. A proactive nurse aide would help organize the resident's shoes and/or set the shoes out for the resident. Doing so helps the resident to maintain independence. Number 18. A resident's wife recently died. The resident is now staying in his room all the time and eating very little. The best response by the nurse aide is to A. Remind the resident to be thankful for the years he shared with his wife. B. Tell the resident that he needs to get out of his room at least once a day. C. Understand the resident is grieving and give him chances to talk. D. Avoid mentioning his wife when caring for him. The correct answer is C. Understand the resident is grieving and give him chances to talk. Number 19. When a resident refuses a bed bath, the nurse aide should A. Offer the resident a bribe. B. Wait a while and then ask the resident again. C. Remind the resident that people who smell don't have friends. D. Tell the resident that nursing home policy requires daily bathing. The correct answer is B. Wait a while and then ask the resident again. Do not forget to document and notify the nurse of the resident's refusal. Number 20. When a resident is combative and trying to hit the nurse aide, it is important for the nurse aide to A. Show the resident that the nurse aide is in control. B. Call for help to make sure there are witnesses. C. Explain that if the resident is not calm, a restraint may be applied. D. Step back to protect self from harm while speaking in a calm manner. The correct answer is D. Step back to protect self from harm while speaking in a calm manner. Use de-escalation techniques while maintaining your safety. Number 21. During lunch in the dining room, a resident begins yelling and throws a spoon at the nurse aide. The best response by the nurse aide is to A. Remain calm and ask what is upsetting the resident. B. Begin removing all the other residents from the dining room. C. Scold the resident and ask the resident to leave the dining room immediately. D. Remove the resident's plate, fork, knife, and cup so there is nothing else to throw. The correct answer is A. Remain calm and ask what is upsetting the resident. If you get close enough to remove the items, you could be injured. Number 22. Which of the following questions asked to the resident is most likely to encourage conversation? A. Are you feeling tired today? B. Do you want to wear this outfit? C. What are your favorite foods? D. Is this water warm enough? The correct answer is C. What are your favorite foods? Is an example of an open-ended question that cannot be answered with a yes or no response. Number 23. When trying to communicate with a resident who speaks a different language than the nurse aide should A. Use pictures and gestures. B. Face the resident and speak softly when talking. C. Repeat words often if the resident does not understand. D. Assume when the resident nods his/her head that the message is understood. The correct answer is A. Use pictures and gestures to communicate with a resident who speaks a different language. Number 24. While walking down the hall, a nurse aide looks into a resident's room and sees another nurse aide hitting a resident. The nurse aide is expected to A. Contact the state agency that inspects the nursing facility. B. Enter the room immediately to provide for the resident's safety. C. Wait to confront the nurse aide when she leaves the resident's room. D. Check the resident for any signs of injury after the nurse aide leaves the room. The correct answer is B. Enter the room immediately to provide for the resident's safety. Number 25. Before touching a resident who is crying to offer comfort, the nurse aide should consider A. The resident's recent vital signs. B. The resident's cultural background. C. Whether the resident has been sad recently. D. Whether the resident has family that visits routinely. The correct answer is B. The resident's cultural background. Some cultures prohibit non-essential touching and physical contact with a person of the opposite gender, with the exception of certain immediate family members. Number 26. When a resident is expressing anger, the nurse aide should A. Correct the resident's misperceptions. B. Ask the resident to speak in a kinder tone. C. Listen closely to the resident's concerns. D. Remind the resident that everyone gets angry. The correct answer is C. Listen closely to the resident's concerns. Number 27. When giving a back rub, the nurse aide should A. Apply lotion to the back directly from the bottle. B. Keep the resident covered as much as possible. C. Leave extra lotion on the skin when completing the procedure. D. Expect the resident to lie on his/her stomach. The correct answer is B. Keep the resident covered as much as possible. Number 28. A nurse aide finds a resident looking in the refrigerator at the nurse's station at 5 a.m. The resident, who is confused, explains he needs breakfast before he leaves for work. The best response by the nurse aide is to A. Help the resident back to his room and into bed. B. Ask the resident about his job and if he is hungry. C. Tell him that residents are not allowed in the nurse's station. D. Remind him that he is retired from his job and in a nursing home. The correct answer is B. Ask the resident about his job and if he is hungry. While the resident may be confused about his location, he could possibly be hungry. Number 29. Which of the following is true about caring for a resident who wears a hearing aid? A. Apply hairspray after the hearing aid is in place. B. Remove the hearing aid before showering. C. Clean the ear mold and battery case with water daily. D. Replace batteries weekly. The correct answer is B. Remove the hearing aid before showering to prevent damage. Number 30. Residents with Parkinson's disease often require assistance with walking because they A. Become confused and forget how to take steps without help. B. Have poor attention skills and do not notice safety problems. C. Have visual problems that require special glasses. D. Have a shuffling walk and tremors. The correct answer is D. Residents with Parkinson's disease have a shuffling walk and tremors. A resident who is inactive is at risk of constipation. In addition to increased activity and exercise, which of the following actions helps to prevent constipation? A. Adequate fluid intake. B. Regular meal times. C. High protein diet. D. Low fiber diet. The correct answer is A. Adequate fluid intake. Number 32. A resident has an indwelling urinary catheter. While making rounds, the nurse aide notices that there is no urine in the drainage bag. The nurse aide should first A. Ask the resident to try urinating. B. Offer the resident fluid to drink. C. Check for kinks in the tubing. D. Obtain a new urinary drainage bag. The correct answer is C. Check for kinks in the tubing. More than likely the tubing is kinked beneath the resident. Number 33. A resident who is incontinent of urine has an increased risk of developing A. Dementia. B. Urinary tract infections. C. Pressure sores. D. Dehydration. The correct answer is C. Pressure sores due to the excess moisture that is on the skin. Number 34. When cleansing the genital area during perineal care, the nurse aide should A. Cleanse the penis with a circular motion starting from the base and moving toward the tip. B. Replace the foreskin when pushed back to cleanse an uncircumcised penis. C. Cleanse the rectal area first, before cleansing the genital area. D. Use the same area on the washcloth for each washing and rinsing stroke for a female resident. The correct answer is B. Replace the foreskin when pushed back to cleanse an uncircumcised penis. Which of the following is considered a normal age-related change? A. Dementia. B. Contractures. C. Bladder holding less urine. D. Wheezing when breathing. The correct answer is C. The bladder is a muscle that gets weaker with age or childbirth. As such, the bladder will hold less urine as we age. Number 36. A resident is on a bladder retraining program. The nurse aide can expect the resident to A. Have a fluid intake restriction to prevent sudden urges to urinate. B. Wear an incontinent brief in case of an accident. C. Have an indwelling urinary catheter. D. Have a schedule for toileting. The correct answer is D. Have a scheduling for toileting. Encourage the resident to use the restroom at least every 2 hours to decrease episodes of incontinence. A nurse aide cannot restrict a resident's fluids without a physician's order. Some residents will refuse to wear incontinent briefs. Also, many hospitals do not allow diapers to be placed on adult patients due to trapped moisture that results in skin deterioration. Number 37. A resident who has stress incontinence A. Will have an indwelling urinary catheter. B. Should wear an incontinent brief at night. C. May leak urine when laughing or coughing. D. Needs toileting every 1 to 2 hours throughout the day. The correct answer is C. May leak urine when laughing or coughing due to a weakened bladder and weak pelvic muscles. Number 38. The doctor has told the resident that his cancer is growing and that he is dying. When the resident tells the nurse aide that there is a mistake, the nurse aide should A. Understand that denial is a normal reaction. B. Remind the resident the doctor would not lie. C. Suggest the resident ask for more tests. D. Ask if the resident is afraid of dying. The correct answer is A. Understand that denial is a normal reaction. Allow the resident to discuss his concerns and then notify the nurse so that she can help address the resident's concerns. Number 39. A slipknot is used when securing a restraint so that A. The restraint cannot be removed by the resident. B. The restraint can be removed quickly when needed. C. Body alignment is maintained while wearing the restraint. D. It can be easily observed whether the restraint is applied correctly. The correct answer is B. The restraint can be removed quickly when needed. Number 40. When using personal protective equipment, P.P.E., the nurse aide correctly follows standard precautions when wearing A. Double gloves when providing perineal care to a resident. B. A mask and gown while feeding a resident that coughs. C. Gloves to remove a resident's bedpan. D. Gloves while ambulating a resident. The correct answer is C. Gloves to remove a resident's bedpan. According to the Centers for Disease Control and Prevention, double gloving is not routinely recommended. Number 41. To help prevent resident falls, the nurse aide should A. Always raise side rails when any resident is in his/her bed. B. Leave residents' beds at the lowest level when care is complete. C. Encourage residents to wear larger-sized, loose-fitting clothing. D. Remind residents who use call lights that they need to wait patiently for staff. The correct answer is B. Many of the beds in home care settings do not have side rails. In addition, research indicates that sit rails do not decrease resident falls. To prevent a fall, leave the residents' beds at the lowest level when care is complete. Also, consider using a bed alarm and assist the resident to use the restroom every 2 hours. Number 42. As the nurse aide begins his/her assignment, which of the following should the nurse aide do first? A. Collect linen supplies for the shift. B. Check all the nurse aide's assigned residents. C. Assist a resident that has called for assistance to get off the toilet. D. Start bathing a resident that has physical therapy in 1 hour. The correct answer is C. Assist a resident that has called for assistance to get off the toilet. Which of the following would affect a nurse aide's status on the state's nurse aide registry and also cause the nurse aide to be ineligible to work in a nursing home? A. Having been terminated from another facility for repeated tardiness. B. Missing a mandatory infection control in-service training program. C. Failing to show for work without calling to report the absence. D. Having a finding for resident neglect. The correct answer is D. Having a finding for resident neglect could result in a nurse aide's professional license to be revoked. Number 44. To help prevent the spread of germs between patients, nurse aides should A. Wear gloves when touching residents. B. Hold supplies and linens away from their uniforms. C. Wash hands for at least 2 minutes after each resident contact. D. Warn residents that holding hands spreads germs. The correct answer is B. Hold supplies and linens away from their uniforms. Number 45. When a sink has hand control faucets, the nurse aide should use A. A paper towel to turn the water on. B. A paper towel to turn the water off. C. An elbow, if possible, to turn the faucet controls on and off. D. Bare hands to turn the faucet controls both on and off. The correct answer is B. A paper towel to turn the water off in order to prevent recontamination. Number 46. When moving a resident up in bed who is able to move with assistance, the nurse aide should A. Position self with knees straight and bent at waist. B. Use a gait or transfer belt to assist with the repositioning. C. Pull the resident up holding onto one side of the draw sheet at a time. D. Bend the resident's knees and ask the resident to push with his/her feet. The correct answer is D. Bend the resident's knees and ask the resident to push with his/her feet. Number 47. The resident's weight is obtained routinely as a way to check the resident's A. Growth and development. B. Adjustment to the facility. C. Nutrition and health. D. Activity level. The correct answer is C. Weight is assessed in order to monitor a resident's nutrition and health. Which of the following is a right that is included in the resident's Bill of Rights? A. To have staff available that speak different languages on each shift. B. To have payment plan options that are based on financial need. C. To have religious services offered at the facility daily. D. To make decisions and participate in own care. The correct answer is D. To make decisions and participate in own care. Number 49. Which of the following, if observed as a sudden change in the resident, is considered a possible warning sign of a stroke? A. Dementia. B. Contractures. C. Slurred speech. D. Irregular heartbeat. The correct answer is C. Slurred speech, facial drooping, and arm weakness are signs of a stroke. Number 50. Considering the resident's activity, which of the following respiratory rates should be reported to the charge nurse immediately? A. Resting rate of 32 breaths per minute. B. After eating, 26 breaths per minute. C. After walking exercise, 28 breaths per minute. D. While watching television, 14 breaths per minute. The correct answer is A. The normal respiration rate for an adult is 12 to 20. Notify the nurse if the patient is breathing abnormally or if the respiration rate is higher or lower than normal. Thank you for supporting Florida Training Academy, a nurse-owned medical and safety training company. We wish you much success with